Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Today, Brad, we're going to talk about the best type of pillow for sleeping with neck pain, pinched nerve, or herniated disc, or herniated disc.
Yes.
Right.
Clarification.
This is a big problem for a lot of people. They're trying to get a good night's sleep, and the pain won't allow them. So we're going to show you positions and things that you can try. We're going to give you lots of tips.
Sure.
So.
And it's good maintenance.
Yeah, right.
Good prevention as well.
Even if you're not having problems, you're going to want to try these things because you don't want to end up with a neck problem.
Exactly.
So,
Precisely.
All right. If you are new to our channel, by the way, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to Facebook and like us, please, because Brad and I, as children, were not liked, probably even picked on a little bit, and now we're trying to turn that all the way around. Maybe you weren't picked on. You learned karate later on, right?
Yeah, that was a later in my life.
You didn't have karate when you were a kid. All right, so the first thing, we're going to kind of give you some guidelines here. The first thing, what you're trying to do is there's going to go over three main categories here, Brad. First thing is you're trying to get the neck in neutral. I'm going to have you stand up, Brad, if you don't mind.
Yeah, because let's go over neutral.
Yeah,
if
what
you're
neutral
not a
is.
therapist, it may be, well, that doesn't make any sense. Neutral, first gear, second gear, you know what I'm talking about?
Right, gotcha. So Brad stands here. Right now, he has actually pretty good posture. His ears are kind of lining up with his shoulders. And that's where you want to see him. So here's the shoulder. You can't even hardly see the ear because he's got it lined up correctly. Show incorrectly, Brad. Right. So at night when you're sleeping, this is the same thing. You want to have your neck in this good position, not in this bad position. And can you see how if you're sleeping on your back and you use one thin pillow, you should be able to keep in a good position. But if you use two thick pillows, it's going to push them right forward. Now, Alternatively, if he's on his side, so now we'll face this way, Brad. Now you can look again here. To have good posture, he wants to be right in the middle. But look at how much huge gap there is here.
Yeah.
So if he slept without a pillow, he'd be way over, and there'd be that stress on the neck all night long. So. And quite often, when you're on your side, one pillow doesn't do it, does it, Brad?
Yeah,
he's still going to bend into the side.
Yeah.
So we're going to use two pillows, and that's going to keep him. Just take my word for it. Two pillows is going to keep him in the right position.
But yeah, the goal is that neutral position and keep your neck healthy.
By the way, I read, Brad, that 70% of the people sleep on their side. So it is more common to sleep on their side. So when you're on your side, you're going to want to come up with a kind of a thicker pillow.
Fill in that shoulder gap.
What about sleeping on your stomach, Brad?
Well, we're not big fans of it.
No, we're not. If you're going to sleep on your stomach, the ideal thing would be that you have one of those holes, like on a massage table, where you can put your head in.
Then you keep your neck in neutral, but if you're on your stomach and your head has to be one way, all the way what we call end range, and it's going to be there for, that's okay, but you leave it there for a length of time, hours or at a time, it could cause problems. I'm assuming people that are stomach sleepers, without knowing it, they probably turn their head right to left. I don't know, but I'm assuming.
Well, yeah, I don't know how else you do it. You're like what Brad's saying. Your head's all the way in one direction. So if you're going to sleep on your stomach, I'd try to keep it limited, and I would try to use a softer pillow because you certainly don't want to be on your stomach and bending up like this, to like this.
Well, I think some stomach sleepers, they just simply don't use a pillow.
No, sometimes they even put their hands there or no pillow at all. You're right.
I shouldn't make fun of this, but I can just imagine someone sleeping all night with their head to the right, and then they get up in the morning and they're stuck.
Yeah, a lot of headaches occur with people who sleep on their stomach. If you're getting a lot of those neck headaches, that may be the cause of it. So it'd be something to think about. All right, a couple tips for trying to get good posture when you're sleeping. One thing you could use. Let's do the towel.
Yeah, we've got a number of little tricks you can do here. Bob's trying to decide which one first.
Did you give me one?
Yeah, it's right here.
Oh, okay. So what you can do, this is just a little thing to try to help keep your neck in place at night. You take a pillowcase and you fold it in half lengthwise. So, I went this way, I fold it in half, and then I fold it in half again.
You do a lot of laundry, don't you, Bob?
Yep, I really got my act together, don't I? And then with it in this position, you can just actually take it and put it around your neck like this, and then tape it in place or pin it in place.
Yeah. Be careful with that pin. You don't want to.
I suppose that's right. I suppose we're covering our microphones now. Anyway, this gives you just a little bit of support, but it helps hold your neck in place at night. We've had some people that like this. I've used this with my people who have vertigo, Brad. By the way, after I do treatment and they're not supposed to look down,
Right.
I put this around them.
Right.
And it's just a cheap way to kind of have a neck collar.
Right. Otherwise, you got to go spend $15 on a cushion, and you only use it for a day.
The other thing you can try is because there's when you sleep on your back or on your side, there's a little bit of curve in here.
Right.
You see? So to fill that in, you can take a roll towel first. Brad, why don't we go the cheap way?
There we go.
Okay, so now if I'm sleeping on my side, I'm on my side like this, and there's a kind of a gap here. I can put the towel here, and I can actually slip it in the pillow itself
Right.
and put it right here. And there it's kind of in place. Gives me a little extra support. These are things you try, Brad, and see if it works.
And my patients that like it, they know. I say, oh, does that make a difference when they have that support in that neck?
And I'm sure there's ones that say, I don't like it at all, right?
Right. Or it might be just the size of the roll.
Right.
Is either too big
You want to
or too
experiment with
small.
that too. And then also if I sleep on my back, I take the one pillow, look how that fills in that gap really nice, Brad.
Right.
So they do make these too. That's a Mackenzie one, right?
That Mackenzie cervical roll. And
Mackenzie cervical roll. I just want to make sure they know what we're saying, Brad.
right, good. Yeah, the original Mackenzie cervical they put on the tag, and they're just more comfortable than a towel, just because the cushion is more consistent and it feels good. But if this works, this is going to work better.
Yeah, it is softer.
Yeah. You just a lot of times once they work, you put it in the pillow and it stays there. And it's
Yeah,
nice.
and then again, it's going to give support for my neck. We're going to mention one pillow. Where are we at, Brad? Is it right here? You go.
Ah, yes, behind you.
Nursal, Nursal. I'll make sure this is in our products below too.
Sure.
It's a memory foam, so it's really nice and soft. Brad and I and his wife,
Right.
then we all try this.
Right.
And it's got a zipper, so you can a washable cover, and it's hypoallergenic. And your wife liked this curve too, didn't she?
I do too, yeah, because a lot of them, most of them go straight across, and if you look at it from this angle, there's a dip in here, which then inherently makes that roll,
you don't need
that
the roll.
support there. It's built right into the pillow itself. But this one also has a spot here, which you kind of fit into that. Your shoulder fits into there when you're on your side, and then it's a personal thing actually.
It really is. I liked it sleeping on my side. I didn't like it sleeping on my back. I'm not going to be one that says go out and get this, because pillows are very, very personal. I mean, beyond trying to get your neck in the right position, how much softness or hardness you want or firmness, that's really individual, isn't it, Brad?
Right. It depends on your body. It depends on your mattress. If you've got a firmer mattress, or
Sure.
so there's a lot of variables.
What did you guys like it or not?
This?
Yeah.
Yeah.
Oh.
We gave it an A, not an A plus, but an A. Yeah.
Oh, nice. Are you a side sleeper or do you sleep on your back?
I'm flopping, Bob.
Oh yeah.
Yeah, but
Mostly
never on
sides?
my stomach.
Okay.
I like to sleep on my sides, but my back doesn't allow it, so then I have to go to my stomach.
Gotcha. Okay. All right. So anyway,
That's a long story.
That's the Nursal. It's $35.99. You can give it a try if you think that's something you want to try. All right. The next category we're looking at, Brad. If you're getting pain going down the arm or getting, we got to take the stress off the nerves.
Sure.
So one way to do that is, by the way, when you're sleeping on your back, you got the thin pillow here, right? And what you're going to do is you're going to go ahead, and I would take another pillow, Brad, and put it right here and support that arm. It just makes a big difference.
It really does.
Yeah.
It's amazing what some of these little things can make a big difference. Like this going around your neck, you wouldn't think it makes a difference, but you try it. It's amazing. This is another one.
And if that isn't enough, you might even try two. Put one beside you and another one here.
Right.
For some people, that's what it takes.
Right. If you've got to go to your kid's bedroom and take their pillows for your good night's sleep,
That's right.
do what you got to do, because they're kids and they can take it.
Yeah, they're tough. So the other thing, if you're going to lay on your side, the same thing. I would try to avoid laying on the arm.
Right.
When the nerve pain is going down. You go ahead and you put up one pillow beside you. This is the arm that's giving me trouble.
Right.
And another one up like this, and again to support it.
Right.
Again, you can almost put two there.
Sure.
Brad.
Well, it's behind
Yeah.
I don't
Anyway,
wanna-
so
I
it
don't
would
wanna
hold it
work
up there.
Yeah.
Again, lots of pillows, I realize, but it makes a big difference if you can. Yeah, there you go. He folded up in half. So, if you are going to lay on the painful side, which we'd highly not recommend that you do, you
Right.
could take a smaller throw pillow, create the canal
Yep.
here, and put the arm in here, and that gives a little. You're not laying on the arm.
Right.
It's not as difficult or more as stressful, I should say, on it.
They
So-
do make a sleep wedge with a hole for your arm on this. We have not tried it yet, but I've seen them on the
I've
internet.
seen a lot of it, haven't
So,
you?
yeah, so we'll have to try those out and give the word
You
out to
better
everyone.
send us one.
Yeah.
All right. The other thing, somebody had asked Brad, how do you watch TV at night in bed, or how do you read a book?
Sure.
So our recommendation on that is to use, what'd you call it, Brad?
That's the sleep wedge. If you
sleep wedge.
Google sleep wedge, there's a lot of them that'll come up. That's the one where they have a hole for the arm too. That's the same.
Yeah, I would
shot.
go. I'll put this in our product section too. These aren't that expensive, but
No.
they're a great thing to do is to just put a pillow like this, and now I'm in pretty good posture, but I can read or I can watch TV.
Right.
So
Because normally what happens if you don't have this, you put an extra pillow or two under your head, then you get that head forward out of neutral position we've been talking about, and it's not desirable.
it's not comfortable at all. So,
No.
and that's the third category we're going to look at is as comfort itself. And again, if you sleep mostly on your back, I would probably get more of a medium pillow, not as firm. If you're on your side, I'd get probably a little bit of a firmer pillow. I realize there's down pillows, there's feather pillows, there's foam pillows, there's memory foam, there's synthetic. There is a website called sleeplikthedead.com, sleeplikthedead.com.
That caught my attention.
And it actually really kind of talks about pillows and beds and mattresses, and it ranks them all in it. So
That's a good deal. Bob.
yeah, it is. It's
kind of like
it's free and it's
yeah.
objective.
Right.
So all right, I think we were ready to quit, aren't we?
I don't know. Should we stop? We're probably boring them to death.
All right.
Sleep well is a big thing.
Yeah.
Sleep well.
Thanks for watching.
Keep the neck healthy.